Although I didn't erase that chapter number, I meant to do that. So we're on Unit 4, even though we haven't taken Unit 3 test, right? This is Unit 4 stuff. This is digestive system infections. I don't know if it's still Chapter 25 in your book. I meant to erase that. So we start out with this particular system and looking at the functions of the main components of our upper digestive and describe the role of the liver in health and disease. So your liver is a component, what we call sometimes an accessory organ to your digestive tract. Remember, your digestive tract is actually considered an external environment for your body. It's basically a tube that goes straight through, and then it has several accessory organs and glands associated with it. Upper GI is your stomach upward, so your stomach, esophagus, your mouth, and the things associated with your mouth, like the salivary glands, your teeth, your tongue. Another name sometimes used for your gastrointestinal tract is the alimentary canal. So sometimes you'll see that terminology used. And then lower GI is, of course, your small intestines, large intestines, colon, and anus. Attached, though, to your small intestine through ducts are your liver and your pancreas, and they're very important for digestion. But because they are connected to this system, they can also be infected through the digestive system, right? Stuff can travel up these ducts and infect the pancreas and or the liver. Your gallbladder is just a storage vessel for excess bile that's produced by your liver. So your liver produces it. If it does not go into your small intestine, it backs up the ducts and it's stored in the gallbladder. So whenever you need an extra little squirt of it, it can contract and inject bile into the small intestine to aid in digestion. And then, of course, your pancreas produces a lot of digestive enzymes as well, and it's, as I said, connected by a duct to your digestive system. So your liver aids in digestion. That bile that it produced and that's stored in the gallbladder when there's excess bile contains bile salts that help the intestines absorb fats and oils. Because these are not very water soluble, these bile salts help surround them, okay, and carry them through this aqueous type solution. So also we have several vitamins that are fat soluble, right, that are not water soluble, and so they too are aided by this ability of absorption through bile salts. So those are your vitamins A, D, E, and K. It helps neutralize poisons, right? Your liver filters the stuff coming through your body. It degrades the medications that you take. And so a lot of times when they do trials, you know, they do trials outside the body and stuff. Why trials inside the body still need to take place? Because there are processes that happen in the body that you can't reproduce in a test tube, right? In a laboratory, out of the body, in vitro, as opposed to in vivo in the body conditions. And then your liver also removes a normal breakdown product of hemoglobin from your bloodstream. This is a yellowish pigment, or yellowish product, commonly referred to as bile pigment, because that's where they put the pigment. And so in addition to the other stuff, this is what gives bile this characteristic green to yellow color, is these pigments in it. And so your bile goes into your digestive tract and becomes part of your feces as well. And why you have a particular brownish color to your feces too is because of these pigments that's present. But if this product is not broken down by your liver, bilirubin, it can build up in the blood. And so some people have a yellowish discolorization to their skin. And in really severe cases like you see in this picture, the whites of their eyes even become yellowed. And this would be severe problem with the person's liver. and is commonly referred to as jaundice. This happens to very young babies, mostly because their liver just isn't up to par just yet in removing that pigment at a rate necessary to not produce that yellow color. Light, UV light, can actually help break down this pigment. So just natural light is one of the ways that they can help treat. I've actually seen somebody once with yellow eyes this bright. It was actually quite frightening. I was working in a doctor's office at the time, and the nurse told me that the patient was going through liver failure. They had had a liver transplant, and it was failing. And so that's why, I mean, bright yellow. I was like, what is wrong with that person? Clearly something is wrong. And so it can be any number of things, but it's definitely a pretty good indicator that something's gone wrong with the liver. It may be diseased, or in the case of that patient, it's failing. And the other thing is it's from the breakdown of red blood cells. So if you have a large destruction of red blood cells over a short period of time, it may be more than just the liver can handle, which is similar to like babies. Like I said, when they're very young, their body just isn't quite up to dealing with that pigment in a fast enough rate. So it doesn't necessarily mean you have a disease, but it definitely means something's going on, right? And it could be a disease where your red blood cells are getting killed at a very large number, more so that your liver can't keep up, or it may be that the liver is damaged. Right? So it can be any number of two things when you see jaundice. Oops, I realized I didn't. So we talked about the liver, but what's the main function of your digestive tract? Digest, right? To break down food, nutrients that you take in, and absorb them into the body, right? So digestion, chemical breakdown, right down to the molecular level, and absorption into the body is the main purpose of our digestive tract. And that's why your small intestines they're small, but they're very long, right? And this is to create large surface area. Even within them, there's many folds, and even down at the cellular level, little tiny microvilli to increase the surface area for this absorption. The main area where that happens is your small intestine. So how is suppression of normal microbiota can be the result of pseudomembranous colitis? And so we kind of talked about this before, right? What's one way that you can disrupt normal flora? What medications could you take that would disrupt your normal flora in your digestive tract? Antibiotics, right? Because remember, when you take antibiotics for infection, your normal flora are going to be affected as well, right? It doesn't target specifically pathogens, right? It just targets particular groups of bacteria. Especially if you're taking a broad spectrum antibiotic, you're targeting both gram-positive and gram-negative bacteria. That's a lot of different bacteria that are affected by taking those types of antibiotics. So your normal microbiota, right, have a very important ability and can help us out. So they protect our body from invasion, right? The normal flora of the intact digestive tract. Mainly they're found in your oral cavity and your intestines. When it comes to your oral cavity, they're not so good there, right? Because they can attach to the non-shedding surfaces of your teeth, and there, when given sugar, organisms like Streptococcus mutans will produce acids that eat away at the enamel, right, and the dentine, and can destroy your teeth, which are of course necessary and help us in chewing up our food, unless you want to be using a blender all the time. Right? So relatively few species do actually colonize the oral cavity, but streptococcal species are most common. We limit, right, the number of bacteria on the mucous membranes. Our membrane cells are continuously being shed as well, right? Although we talk about epithelial cells of our skin being shed, so are your mucosal cells continuously being shed and replaced. Your teeth, on the other hand, as I said, are a non-shedding surface, and biofilms can develop. This is where you have collections of bacteria attached to your teeth. We commonly know this as plaque, right? But it is a biofilm, right? There's a reason why the dentist wants to scrape it off, wants you to brush it off, wants you to floss it off, because it contains bacteria that can be pathogenic, that can produce things to destroy your teeth, right? And so the presence of plaque is not good. You definitely want to try to remove it. So the other place we have a large number of normal bacteria that are normally present are in your large intestines. Very small numbers are actually inhabit your small intestines. The ones that do are aerobic to facultative gram-negative bacilli and some streptococci. The largest number, and it's estimated about 1 billion per gram, 10 billion per gram of feces, because that's something we can measure that comes out of your digestive tract, right? There's about 10 billion per gram, and a gram is a very small amount, y'all. Very small amount. So the high population is due to the abundance of nutrients in feces. Believe it or not, there's quite a bit of stuff that you can't eat, right, that leaves your bodies in the form of feces. E. coli, we've talked about this particular bacteria, right, is probably one of the most predominant. And again, non-pathogenic strains are what we have. If you had a pathogenic strain, a strain that produces toxins or things that make you sick that we'll talk about in a moment, then you wouldn't be feeling so good and you wouldn't be in class today. So other enterobacteria, this is a general name given to the bacteria that inhabit the intestines of warm-blooded mammals like ourselves. The unfortunate thing for these guys is they can be potential pathogens, right, when the opportunity arises. So when they're in our gut and they stay in our gut and they leave our body through feces, then they're not going to create too many problems. But for women, one of the unfortunate anatomical problems that we have is the close proximity of the anus to the vagina as well as the urethra. And so we're all taught when we're very young, right, when we're very young children, how to wipe after going number two, after going poo, that you need to wipe back, not forward, right? Because if you were to wipe forward, then you're dragging feces into the vagina and into the urethra. And it's been several years now, but there was actually a case in Louisiana where a little girl died of something that simple, of not properly wiping, where bacteria got into her urethra, traveled up into her kidneys. Parents didn't realize how sick she was. By the time they seek medical attention, it was too late for her. So, you know, we get kind of, people, you know, don't like to talk about certain things like that, but they can be literally life-threatening, important situations. Now, males have the unique anatomical difference where their urethra usually is quite a long distance away from the anus, so they don't have that whole wiping issue that women do. But you have to teach men these things too, because nowadays even guys change diapers, right, of little girls. So you have to teach them the importance of how to wipe that bottom, beautiful bottom of ours. So normal intestinal flora, they being there, we've talked about this, like the ones on our skin and such, because they're there in our intestines, there's less likely that a pathogenic organism would be able to take up residency. They won't have any place to park, right, because the normal flora are there, and the normal flora are eating the excess nutrients that we did not eat, okay? It's when you take antibiotics, right, that in long-term, broad-spectrum type antibiotics that you can potentially end up with this condition where pseudomembranosis, meaning that there's destruction to the membrane, colitis referring to the large intestines. And so a lot of times it's associated with, like I said, the use of antibiotics, where you kill off your normal flora, and then you're exposed to pathogens in the environment. you ingest them, and then when they get to the intestines now, the normal bacteria aren't there to fight with them, and they're not taking up those resources, so the pathogen is able to take up that resource. So Clostridium difficile is a really serious infection that can happen. It's an anaerobic bacteria. It's a toxin producer, right? So this is what's lethal to the intestinal epithelium and can cause small patches that are referred to as pseudomembranosis. And these are areas of death, and so there's no, it's not viable tissue, right? And it can be very damaging. Our intestinal bacteria do produce a lot of vitamins for us, right? So niacin, thiamine, riboflavin, B12, folic acid, right? We don't produce folic acid. Microorganisms produce folic acid. You can get it from some of the foods that you eat as well, vitamin K. So a lot of these, you know, it's a mutualistic a relationship with them. We're giving them a place to live and food to eat, and they're giving us necessary vitamins for life. I've been told that Clostridium difficile smells really bad, this particular infection. And then my students from some of my other classes have told me one of the ways that they help cure this infection is they give someone a fecal transplant, usually from someone in the same household because you've been exposed to the same type of microorganisms. Because your ecosystem of your intestines has been disrupted, right? And so one of the ways in helping treat is to put the good bacteria back there by putting someone else's poo in your intestines. Pretty gross stuff, right? But makes sense, right? And so the other thing that happens too, if you're ever out in the country and stuff like that and you see young horses, they'll eat their mom's poo. And part of that is to establish that microbial environment in their intestines. I know when I was a kid and I seen that, I was like, oh my gosh, stop that horse. And they're like, oh no, they're supposed to do that. I'm like, really? Now, on the other hand, if your dog is doing that, it's probably because his diet's poor or they've got some type of something going on. And the unfortunate thing is that sometimes some of them, when they learn that, they continue to do that. And you don't, like I said, you don't necessarily digest all of your food. There's still quite a bit of food in feces, and that's why dogs will smell it. They'll smell the food component, and they will still ingest it. It's pretty gross. So you guys ready for one more, and I promise to stop being gross? I had a student, male student, he was watching his young toddler, and not so well. Left the room and came back, and the little one was eating his poo, his own poo. And he, you know, he freaked out and everything like that. And he goes, but Miss Erica, I don't understand why he didn't get sick. And I'm like, the reason why is it's his own poo, right? And that hopefully, you know, unless he was already sick, there isn't anything pathogenic there. So if he doesn't get it in some other part of his body, going back into the digestive tract isn't necessarily a bad thing. Right? It's when you come in contact with other people's stuff, not to say that you should do that, right? I don't think anybody would want to do that, but that's the reasoning behind why dogs will do it, animals will sometimes do that, right? There's different factors. There's still a food component to it, and there's a microbial component that's necessary for certain animals. But for the most part, right, we usually want to stay away from it because it can be an opportunistic pathogen, right? When it gets other places, right, gets into the vagina for women, the urethra, even into your skin, right, into a wound in your skin, those organisms in that area can cause some really serious problems. So this isn't a misspelling. Dental caries is actually the proper term for dental cavities. Periodontal disease and trench mouth, these are all pretty well linked to each other. Plaque is the main contributor to dental cavities, and as I said, Streptococcus mutans is the most common offender, and the reason for that is it takes sucrose, right, sugar, and it breaks it down and produces acids that can deteriorate your teeth. So this is a worldwide problem, right? The young are more susceptible than the older. This is one of the reasons for the fluoride in toothpaste, right? It's antibacterial in action to help eliminate the bacteria. If you're a sugaraholic like me, right, eat your candy and then just go brush your teeth, right? Don't leave any excess sugar in your mouth for those organisms to be eating, right, and producing those acids and continue to be growing. Brush your teeth, floss your teeth. People say, you know, do you have to floss all your teeth? And someone once said to me, and this is a good statement, no, just the ones you want to keep. Right? In other words, if you don't floss them, you're not going to be able to continue to keep them. And the reason for that is that your toothbrush cannot get to the spaces in between your teeth, right? And along the gum line, as well as floss can. And so, although we hate it, right, it's an important part of saving your teeth. And especially, plaque is the contributing factor to the next disease, which is periodontal disease, right? And this is the plaque builds up, right, and forms at the gum line margins. And remember, it's bacteria. It's a biofilm of bacteria is what dental plaque is, okay, stuck to your teeth. Well, what happens is the bacteria come in contact with the gums, and the gums are fed by, you know, blood supply and everything like that. So are your teeth. Your teeth are actually living entities, right? They have nerves. You can feel when they're not happy. The problem is those bacteria coming in contact with the gums, then you get an inflammation reaction. And remember, inflammation is trying to kill the bacteria, but also it's going to cause destruction of those gums. So then, do I have the gross pictures, or did I take them out? I took them out. Too many of my students making faces at me. So they get the gross pictures in your book where the gums recede. And so then you see more of the teeth, and you can even see sometimes down to the roots. And that's why it seems like their teeth, like you said, are what?
Well, no, I was thinking about, like, maybe they have such, like, bad plaque buildup that you don't even see the lines in between their teeth.
Oh, yeah.
I think they have, like, connected teeth almost.
Oh, I've never seen that, thank goodness. So she was saying that in some instances the plaque can be so bad that it blurs the line between the teeth where the teeth meet.
Yeah.
Right.
I've seen that a lot of old people. Like, it looks like their teeth are just like horse. You know, like horses have like the
wider teeth.
Yeah.
Ooh, yeah. Okay. So as I said, you know, gingivitis is another name for periodontal disease, and again, it's referring to this destruction that can happen over time, and you know, it can be quite serious condition because if the gums recede extensively, then you have tooth loss, right? And you can't put, you know, even fake teeth in there if you don't have anything for it to attach to. Right? So it can be really ugly. And so, of course, you see this in older individuals, right? 35 years or older typically are at the greater risk because by this time, this is if you haven't gone for your regular cleanings, if you haven't maintained good oral health, then there's the potential of so much buildup that now you have that condition where it's extremely inflaming your gums. So they can, of course, the best way to prevent it is to remove plaque, right? Go for dental cleanings on a regular basis. Surgical treatment in severe cases, right, where they have to go down in the gums along the roots of the teeth and scrape out the plaque that is there. So trench mouth, on the other hand, they believe is probably caused by several different spirochetes. And this is a rare condition. We usually don't see this, but again, homeless individuals, elderly, people that don't get proper medical help. One of the reasons why it's called trench mouth is it was a problem during wartime, right? When you're down in the trenches, you're not really necessarily worried about brushing your teeth. You're worried about staying alive, right? And of course, being down in the dirt and stuff like that, you may be exposed to microorganisms you weren't previously exposed to, right? They can establish residency, and these guys will severely be destructive to the gums of the teeth. And And so, although everyone is susceptible, again, it's really associated with really poor dental care, malnutrition, immunodeficiency. It's not thought to be contagious, right? Again, it really has to do with how well somebody maintains their oral health. There is antibiotic treatment for the acute phase, right? Hopefully before it becomes so substantial. So pretty gross stuff. So moving on to our last part of our upper digestive, and that relates to our stomach. There's very few infections that you hear about for your stomach. There's one that's been discovered relatively recently. Helicobacter pylori is named after the fact that it can infect the stomach. And this is a very interesting bacteria in that it's a spirochete, not really shown here. It has a protective sheath around it, and this sheath produces an enzyme called urease, and urease can take the urea, which is a byproduct of the breakdown of proteins digestion that happens in our stomach. So they take that product and they produce ammonia. And what ammonia does, so they have this stinky ammonia field around themselves, is neutralize the stomach acid. Hydrochloric acid found in our stomach usually kills just about anything that makes it into the stomach. But in this case, this guy creates his own zone of protective ammonia that neutralizes the acid so that he doesn't get killed. In addition, he has flagella. So he can, did I say spirochete? He's a spirillum. He's a spirillum, not a spirochete. He doesn't corkscrew, right? But he's a long rod that has curves to it. You can kind of see one curve here, one curve here. But this flagella helps it swim through the mucus. That's the other protective, very thick protective layer in your stomach. And so this guy swims through the acid, swims through the mucus unharmed, gets to the epithelial cells lining the intestines and kills them. So then your stomach starts basically eating itself because the cells that are producing the mucus are getting killed, right? So here it is, it swims through, right? It gets down to the epithelial layer, right? Starts killing these cells, and our immune system starts responding, right? So you get inflammation in the area. And the gastric acids, you no longer have the mucus in that area to help protect it, so you start eating away at your own stomach. And this type of wound is referred to as a gastric ulcer, right? And so at one time they thought that ulcers were caused by other things, but some ulcers are actually caused by a bacterial infection. What's the good news is if it's a bacterial infection, we can treat with antibiotics, right? Hallelujah, right? And also they're usually going to have the people take some type of antacid to reduce the amount of acid that's produced for the healing process to be aided for that. So a spiral, right? Spirillum, gram-negative, microaerophilic, just needs a little bit of oxygen. Of course, your stomach could potentially have a little bit of oxygen in it, right? Sheaths, right, help protect it. And that ability to produce that urease that breaks down the urea into ammonia really helps it make it through and actually survive in the stomach without being destroyed. So they believe it is probably a fecal-oral route of transmission. So somehow you've come in contact, right, with poo and ingested it. Progressively increased with age, reaching about 80% of those over 75 years old may experience this type of infection. No proven preventative. Most infections are cured using 2 antibiotics together, plus, as I said, medications to reduce stomach acid to allow the stomach to heal. Herpes simplex virus type 1 can easily spread from person to person. And the bad news with herpes viruses is once infected, always infected. The most common manifestation of it around the mouth is what we commonly refer to as cold sores. Okay, and this is when the virus is multiplying, it's erupting, the immune system is responding, and you get that sore. The virus is typically transmittable via saliva. So a lot of times people refer to kissing as swapping spit. You kind of are doing just that. And so you can transmit this virus. Right? It's usually insignificant, but it can be fatal for individuals who have immunodeficiency. So an immune response quickly limits the infection, but non-infectious DNA persists in the sensory nerves, right? So just like with chickenpox, right? There's another herpes type virus. It hides in those sensory nerves, so it can re-erupt at any time whenever the immune system isn't keeping a watchful eye on it, right? And then you get the cold sore again. It's of course most commonly transmitted when there's a sore, right? But it can be transmitted at any time, and that's why it's quite prevalent. Sharing things that like lip balm and stuff like that too can spread it. There's several antivirals that can be used to help shorten the duration of the illness, get the virus to stop multiplying. Sunscreens are helpful in preventing reoccurrences due to ultraviolet exposure. So remember, UV light damages our DNA, right? And so if the DNA is damaged, it might cause damages in that cell that may reactivate the DNA hiding in those sensory nerve cells, and that virus re-erupt. So given the characteristics of mumps virus, what characteristics of the mumps virus would make it a good candidate for eradication? So we've already talked about mumps previously. What do we have against mumps, this virus? We have a vaccination, right? So that's step one for eradication, right? It is believed that it's human only, right? That only humans transmit this virus. They believe there's only one serotype, right? So you know how I just spoke about the herpes simplex virus 1 that typically causes cold sores? Type 2 is typically what we were talking about when we talk about genital herpes. But you can get either type in either place depending on what you do, right? Okay, so there is a belief that there's just one type, and so if that's true, then our vaccination should be sufficient. But we've already looked at the epidemiology of this, right? We've had some serious outbreaks of mumps and such. What's the mode of transmission? I'm all right. How do we transmit it from one another? Spit, right? Spit and respiratory, okay? Long incubation period, right? Which is probably one of the reasons why it persists in our environment. As we said, it's part of the measles, mumps, right? And rubella, the MMR. No effective antiviral treatment, although I think now there probably is some. This poor little boy, right? Do you see the swelling to his face? What is inflamed? This one targets your salivary glands, right? And there's a salivary gland on the side of your face near your ear here called your parotid. Salivary gland. Oh, I thought I had the answer there. I probably have it here. Yeah, parotids. So the virus initially replicates in the upper respiratory tract, then disseminates to the parotid or other glands of the body via the bloodstream. The inflammation response to cell destruction is responsible for the marked swelling and pain that individuals experience. So one of the interesting things about this infection, it was extremely widespread, I guess in the 50s, before we had vaccination for it. Most people got the mumps. And so there's, I'm a big Kevin Costner fan, and there's a movie that he did called The Postman, where it was set in a time frame where there was some catastrophic event and we no longer had communication, and he found a postal worker's outfit and stuff and delivered the mail. Basically made himself a postman, and he went to this one particular community, and the lady wanted him to have sex with her so that she could have a baby, because her husband couldn't produce babies because he had the mumps. So we're like, well, why would the mumps cause you not to have babies? Well, for some men, sometimes the virus, as I said, prefers the parotid salivatory glands, but for men, it also sometimes will affect the testicles. So in this case, right, it affected the testicles and made her husband sterile, right? He could no longer produce children. That's a very strange complication that could potentially happen with the mumps, and has been documented in the past of being a reason for infertility in males. So notice that the vaccine was instituted in 1967, right? So since then, we've had a marked decrease, except for some outbreaks that we've been seeing, and there's definitely been the question of, how effective is that vaccine, right? And what's going on with that. So lower digestive tract, right? These tend to be the more serious infections, a lot of them contributing to quite an upset to the digestive system. So cholera, caused by Vibrio cholera, Campylobacterius, caused by Campylobacteria junum, several enterobacteria. Shigellosis is caused by several different species of Shigella. When someone says someone has gastroenteritis, they're usually referring to an E. coli infection of the intestines. And salmonellosis is, of course, not a dinosaur, right? But caused by, again, several species of the genus of Salmonella bacteria. So when we say gastroenteritis, we're usually referring to an acute inflammation of the stomach and intestines. The syndrome is noted by nausea, vomiting, diarrhea, and pain in the abdomen. So again, this is just referring to inflammation, right? It could be caused by any number of the bacteria we just mentioned. Dysentery is a much more serious condition, and this is usually characterized by crampy abdominal pain and bloody diarrhea, right? So the blood and the diarrhea usually denotes some type of destruction to the intestines by the pathogen, whether it be the pathogen itself or toxins that it produces. So the most common source of bacteria pathogenic to our intestines is referred to as fecal oral route. And this is usually when a person ingests food or drinking water contaminated with animal or human feces. Right. So, and of course, microorganisms can be teeny tiny, so very small amounts, non-detectable, right, could make you sick.
So the dog drinking out of the toilet?
Yeah, not a good thing. List the mechanisms by which bacterial pathogens cause diarrheal disease. So remember, the very important thing, and this is true from all infections, right, is attachment. That initial attachment of the bacteria. Now, one of the things that helps us with our digestive tract is the lining of mucus, right? And also the movement of stuff through the tract, right? It doesn't stay there for long periods of time. We're continually moving through it. But most of the ones that infect us have papillae, right, or fimbriae, specialized protein appendages that allow them to attach. Others have other type of adhesion receptors, ways of sticking to our epithelial cells for the initial attachment. Some of them, too, have secretion systems. So once they attach, they can secrete stuff into our cells that makes our cells more apt to have the bacteria attach to them. So they cause deformities and such in our cells so that even more of the bacteria can attach. And then the really bad news when it comes to diarrheal diseases is that once they've attached and they colonize and establish residency, a lot of them produce toxins. So there's two main groups of types of toxins. There's toxins that increase the secretion of water and electrolytes, as is seen with Vibrio cholera. And so this contributes to the diarrhea, right? The movement, the quick movement of stuff through the digestive tract, because instead of the water being absorbed, instead this organism is causing us to put the water and the electrolytes into and leave it in our feces and go out our body. And this is probably the worst part of it, is because you need this water, right, and these electrolytes for the normal functionality. So if you don't quickly replace this faster than it's removed, it can be lethal, right, from dehydration. Toxins that cause cell death by halting protein synthesis, as seen with Shigella dysentery. So this is a very serious form of Shigella, right, infection, where they're actually causing destruction to, and hence why it gets the name dysentery, because you now are going to end up with the bloody diarrhea because of the destruction of the cells of the intestines. Others will cause alteration in our host cells. So some of them have what's called a type 3 secretion system, and literally this is a protein apparatus that it can form. It almost looks like a hypodermic needle, right, that it uses to inject stuff into our epithelial cells. So certain pathogenic strains of E. coli deliver substances into the intestinal epithelium using this type of delivery system. When that happens, it causes inside the cell, so they are injecting stuff into our cells. It causes the actin filaments that are present in our cells, part of our cell cytoskeleton, to deform, and they lose, that causes them to lose the microvilli, right? Those cytoplasmic projections that they have for increased surface area for our cells. It deforms those and basically creates a pedestal or a platform, again, for more bacteria to be able to stick to it, right, and establish residency attached to those epithelial cells in our intestines. Then some of them will invade right into our cells. So in addition, some of the type 3 secretion systems, when they secrete stuff into our cells, it causes changes in our cells that causes our cells to engulf the bacteria. Remember, only usually phagocytic cells are going to do this, right? They're actually purposely causing our cells to engulf them, right? And so Shigella species do this, right? And the bacteria then are able to multiply inside that cell cytoplasm, leading, of course, to destruction of that cell, right? It becomes intracellular in that case. Cholera typically is a problem in other parts of the world, not so much here. Again, think about this. Most of these things are fecal oral route. We do a really good job here in the United States of making sure we don't come in contact with fecal matter, and fecal matter isn't contaminating our food or waterways. So this was an older slide that I kept in the presentation, only because at that particular year we had 4 cases. As you can see, very few cases each year, and we'll look at some of those numbers. But the focus was cholera infections were associated with consumption of contaminated shellfish harvested in local waters. So again, you know, fishermen and stuff like that complain, especially the oyster fishermen sometimes complain about the regulations on them, but it is necessary for public health, right? How long, where we're harvesting, that these things are tested, that they're kept refrigerated, right? And so we've significantly lowered the risk of infection because of that. So I looked at the CDC's website. I didn't look for this year, but last year there were 0 cases of cholera in the United States. And so notice that the numbers are relatively low. I took a peek at this 40, And it was very similar to what's stated here, is that the people were, obtained it from travel, right? They acquired it elsewhere, not in the United States, right? And then traveled back to the United States. So that particular year, I think there was a lot of travel to Haiti. Was that the year with the tsunami? I couldn't remember. I didn't look that up. It just came to me. I'm like, wait a minute. They said Haiti, and it might have been the tsunami year. So it might have been relief workers or whatever. But again, Haiti's listed here as well for 2012 in the Dominican Republic. So in other countries, and then even somebody got it in the lab. Somebody was not careful. So we'll pick up here next time. I'll have the other one posted for you guys. Remember, Wednesday is the test. This is not on the test. This is Unit 4 stuff. So we just have a few more slides left in this one, not too much, and then we'll start nervous system.